Do you know the #1 medical reason why women do not go to work on Mondays? Today, Dr. Sherry Thomas is here with the answer. The answer is
Bladder infections.
If I had a bladder infection, I wouldn't tell anybody that. So where did they get that statistic from?
Well, it turns out women get 1 or 2 bladder infections a year.
Okay.
And most of us drink a little bit more water and try to clear it ourselves. But some women just get recurrent infection after recurrent infection. And it keeps them out of work, and it is the #1 cause of lost days for women. Yes. So I'm not sure where they get the statistics, but yes, I agree with you. I wouldn't call them.
I thank you for that stat because I'm in human resources. So now when my staff comes in and they say they have the flu, it could be a bladder infection.
Right. But it's good. It's important to follow up on that.
Right.
So when you get your bladder infection, you may have an antibiotic at home and take it, but follow up with your doctor and get that urine culture to make sure the bladder infection went away.
Well, even before we get, what are some of the symptoms that person could?
The symptoms are easy.
Okay.
Burning with urination.
Okay.
Urgency, frequency. You may even try to urinate and nothing comes out. Or women may have blood in their urine. And that blood in the urine is a very big concern if you're over 40. You want to run straight to your doctor and get that worked up to make sure it's just a bladder infection.
Is there anything that I could do preventative? Because I've had them before and they are awful. Is there anything that I could do?
Very simple and very inexpensive.
And what is that?
Drink 8 glasses of water a day.
Water is the solution to all that pain?
Water, not Coke, not alcohol, but water. Okay. And if you're menopausal, it turns out using a little vaginal estrogen helps because it helps change the pH.
Okay.
All of us can eat a little bit more lactobacillus, so we can do that in either Greek yogurt or just take some lactobacillus over the counter. And that helps give us friendly bacteria in our gut.
Okay. So I didn't drink the water. I have all the symptoms. I'm full blown now and I have my antibiotics. Is there anything that I should be paying attention to while I have the bladder infection?
So you have antibiotics and you're going to take them. Yeah. So take your antibiotics and make sure that you take every one of them your doctor gave you. And when you're done, follow up and get a culture to make sure it went away. Because that's where we get the recurrent infections. People don't take all their antibiotics or they don't follow up, and a month or 2 later they have it again. Well, it turns out that same infection was just suppressed, but it's now brewing again. The other thing is when you're taking your antibiotics, if you're getting more sick, you can't keep down fluids, you're running a temperature, that's not just a bladder infection, that's a kidney infection. And you need to get right into the emergency room hospital right away. When you get a kidney infection, that's serious. So
a kidney infection is an extension of a bladder infection? You can't, is that how that works?
Yes. So many times when we get urgency, frequency, and we blow it off, oh, I'm tough, I'm a woman, I can survive that. And then it brews for a while, we can actually get a kidney infection. Okay. So the kidney infection you want to get on right away because that can be serious. Remember, before antibiotics, that's how people died, and that's how you lost a kidney because we couldn't treat it.
So let's say I have a bladder infection. This happened to me before, and the antibiotics are not working. Do I go back to my doctor and ask for different antibiotics? Can I mix antibiotics?
Yes.
How do I make it go away?
You don't want to be your own pharmacist and start mixing antibiotics. So immediately you start your antibiotic. Within a day or 2, you should start feeling better. If the day 3 you're not, call your doctor, get back in. A lot of times, as I am actually a urogynecologist, so I take care of a lot of women with recurrent bladder infections, I'll obtain a little bit of urine from you through the urethra to make sure the organism you're growing, we get the right antibiotic for that organism. And that is so important.
Okay. So the key is, 1, to get to the doctor, 2, to continue the antibiotics because, once I start feeling well, and I do this all the time, I may have 30 pills in a bottle, but by pill number 10, I'm feeling good, and I'm like, oh, I don't need to take any more pills. That's not good, right?
Right, because you don't want to just suppress the organisms. You want to clear them up. You don't want to have that infection a month later, and then take what's left in the bottle, and then 2 months from now you have the worst infection that most antibiotics won't treat.
Why are bladder infections so painful? Why are they? I mean, they hurt.
Because it's an infection in the bladder, and that's why we see blood sometimes.
Okay.
It's an infection that is irritating, and the bladder just wants to get rid of the infection, so it contracts and cramps.
What else can cause a bladder infection besides what you've mentioned?
Well, the common causes of a bladder infection are sexual activity.
Oh, okay. That's why people
stress,
don't say they have them.
and travel. So after sexual activity, get up, urinate, and drink a big glass of water. When you travel, make sure you're drinking lots of water. And other things like spinning, wearing too tight of pants. You may just need to, change those thongs for some granny underwear. Or better yet, go without.
Now, I don't know if they're going to change the thongs for some grannies, but I do. I do. Okay, so, and then after sexual activity, I should urinate. And real quick, what if I can't urinate? What should I do real quick?
That's because you're not drinking enough water. Drink that big glass of water.
Okay, you've helped me because now I know when my staff calls in that they have a bladder infection and they didn't want to tell me. They called it something else. Dr. Thomas, it was a pleasure having you. Listen, you cannot take care of others unless you take care of yourself first. Stay tuned for more Every Way Woman.